back to Ethics for the Modern Massage Therapist. So we established some we established some definitions with regards to codes of ethics and standards of practice and scopes of practice, but now we're going to get into boundaries. So that's kind of why I said the word boundary right from the beginning. It's on my brain. So anyway, what we want to do is sort of explore how boundaries affect us as a massage therapist and how that plays into our ethical minds. So Amelia, going back to the concept about boundaries, let's talk a little bit about good and bad, or I don't want to use the word bad, but maybe unhealthy might be a better one. Let's just talk a little bit, just a little foundation about that.
Absolutely. Boundaries overall are where we start and where we stop. Now, they can be physical boundaries where I can literally, feel where you start and I stop. They can be more energetic. All of us have sort of had the sense of someone coming in the room. We're aware of people even if we're not touching. And then there are all sorts of interpersonal and emotional pieces, and that's really where we run into boundary issues the most. And what is appropriate in different settings, what is appropriate between different people, how we respond to different client personalities. These are they're affected by our own personal boundaries and our clients' boundaries, and that's why it's something that's really important to talk about. Mm-hmm. Unhealthy boundaries show up when we are not able to speak for ourselves and lay out what is okay and what is not okay. Mm. When it feels like other people, even if we're speaking, other people are kind of bounding over our boundaries and they are not listening to us, or it feels like they might be taking advantage of us. There are a lot of places where unhealthy boundaries can really drain us. So that's one of my real prime places. If I'm with somebody that it just doesn't feel right and I'm really feeling drained, I probably need to look at my boundaries around that situation.
Yeah, and that's not something that's easily taught,
No.
It comes from experience, but even the most experienced therapists, I think, have a hard time with that on occasion. So it is really good to have that great moral compass in that sense, so when that situation comes along, that you can sort of ground yourself and kind of at least get a grasp of what's going on and how you can best handle it. And you still may not handle it overly great, but you're at least aware of it, and the awareness is half the battle, I think.
Exactly.
Yeah.
And I will add to that very often if I find myself charged in a situation, that's a point of reflection for me. Mm-hmm. It may have something to do with the other person. However, if I'm finding myself charged, my job, especially as a therapist, is to step back and get myself settled and grounded and figure out what's going on there.
Yeah, absolutely. And I want to draw your attention to, there's a resource that's been posted in the course. It's called the Boundary Issue Identifier. So we would encourage you to go ahead and take a look at that because it asks some really poignant questions of you as the therapist in terms of where your boundaries are, what things might charge you or not charge you. So definitely a great resource there. I would highly recommend that you take a look at it. So it kind of gives you a few things to think about. Yeah?
Absolutely.
Okay.
It's one of my favorites.
All right. So let's kind of go into a few scenarios. Now, some of these may be somewhat typical, but I think that there are challenging scenarios with regards to boundaries that I think many massage therapists have to deal with on a regular basis. So let's go over a couple scenarios if you don't mind.
Absolutely.
Okay. So here is, suppose you have a friend who keeps scheduling and then canceling at the last minute. How do you handle something like that?
Friends and family are some of the hardest places because what was okay when we were growing up within the family or what's okay within our friendship out in the world doesn't always work between client and therapist. And I know this has happened to all of us where we have a friend, we want to help them out, we want to work on them. But all of a sudden, their life, and you know about their life because you're friends, their life becomes more important than getting in to see you. And all of a sudden, their life is bumping into the success of your practice because that was a time slot that could have been filled by another client. And all of a sudden, you're sitting there twiddling your thumbs. This is a place where I am a big proponent of hard conversations.
Yeah.
Hard conversations generally don't last very long. However, they make the world of difference in functioning in this world.
Mhm.
This is a place where the client, the friend, is not respecting your professional boundaries. And you can do one of two things. You can be grumpy and angry and let that leak out all over your session, which is entirely unprofessional, or you can speak to your friend about it.
Mm-hmm.
And it doesn't have to be a big confrontation. It can simply be, hey, I'm really trying to build my practice right now. If you're not going to be able to come in, I need you to give me the same notice that I ask my clients, which is 24 hours or whatever it is. I need you to let me know. If that isn't going to work for you and you want to do it differently, I can let you know the same day if there's an appointment that you could pop in for instead.
Mm-hmm.
So I've set my boundary with my friend and said, hey, this isn't working for me and this is why.
Mm-hmm.
And then I've offered two alternatives. Either you can respect this policy, or if I happen to have something open, I can let you know on the same day, and if that works for me, you can come in. So those are both perfectly reasonable things to say to somebody.
Right.
Nobody really ought to get their feelings hurt. But what I have done is I've taken care of myself, and I have reinforced my professional boundary so that my friendship stuff isn't piling over that.
Mm-hmm. Yeah, absolutely. So, and I actually advise that of my students too, because with my students, a lot of times when they're in school, they practice on friends and family, and of course they're not allowed to receive any type of remuneration while they're in school. But you want to, as you're a student, you want to practice as much as you can, because the more hands-on work you get, the more proficient you get in your skills. And of course students love to do that. But then once that graduation happens and the licensed massage therapy, you get your license in your hand, you're all excited about that. I encourage them to have those hard conversations to kind of allude to that as graduation comes closer, because for the exact reason that you're saying, a lot of times your friends are your best referrals in terms of clients, but you also have to make sure that you don't hurt their feelings, but at the same time you can't allow them to take advantage of you. And so it's definitely a difficult place to be in. But let me just ask you, since we are on the topic of friends, how is it that you've interacted with your friends? Were some of your clients your friends that you worked on before, while you were in massage school, and then they became your regular clients? Or was it after the fact where they're your clients and then your friends, or so forth, or whatever the case may be? I know we haven't gotten into relationships or, that type of thing, but while we're on that topic, I figured it might be a good idea because it applies to this particular scenario.
It does. It's actually a really good place to take this. Interestingly for me, and it's not the case for everybody, but it does seem to be the case more often than not, I had a wonderful opportunity to apprentice while I was in massage school. So I was able to see a lot of different people as clients and really practice and build my craft while I was still in school. Very interestingly, I did not see those clients once they were expected to pay. They loved me as a free massage therapist.
Of course.
And they were great clients, and I got great testimonials from them, but they did not turn into long-term clients.
Ah, okay.
So for me, and some of them are still friends, the clients that really built were the people who started seeing me after I paid. They were willing from the beginning and continue to be willing to pay for the service that I was offering.
Yeah.
So sometimes there is a little disconnect between that. And I say that mostly to encourage people to work on everybody. Just don't always expect them to show up as paying clients.
Right.
Frankly.
Exactly. Uh-huh.
Now, I've been in business now for 14 years. I've got a few clients in the practice that have literally been with me for 10, 12, almost 14 years.
Yeah, that's great.
Which is a wonderful piece, because my practice has narrowed and specialized into lymph drainage specifically. I'm not doing massage, which gives me a little more space in relationships, because there are some people that I have come to know well and who have become friends.
Mm-hmm.
And for me, it is very helpful that they are continuing to come to my practice. I love them, they're great people, but I'm not actually their therapist. And that really eases the friendship piece.
Yeah.
I know there are other people that I could tell are developing into friends because I see them so often, but I'm very careful at defining that with people. I don't become Facebook friends with people immediately.
Which we'll talk about that.
We'll get to that.
Yes,
we'll get
social
to that.
media is a whole nother topic, but
Yeah.
yes, I'm glad you mentioned that.
Yeah,
So.
I'm not going to be Facebook friends with them. I'm not necessarily going to go out and hang with them. I
Right.
take a very long time with that.
Yeah.
In terms of a client turning into a friend. I'm very cautious with that because the power differential that I'm the therapist and they're the client, that's hard to get rid of. You need, like, that just doesn't go away because
Right.
we go out for coffee. So
Right. Good terminology too. And power differential applies to all kinds of allied health professionals, not just massage therapists. So yeah, oh great. So this is excellent. All right, so let's move on to another scenario because I feel like we've probably discussed that first one well enough. So what about your office having a cancellation policy and is it adhered to? How do you adhere to that with your clients?
okay, so this tags right back into the conversation about a friend canceling. Whether it is your personal office or you work for an office, is there a cancellation policy? Do you have clear boundaries around time and what people are expected? Because if you have no clear boundaries and somebody does not show up on time or just blows off their appointment, what are you going to do? You really have nothing. However, if you have clear boundaries with a cancellation policy, then you have something to have a conversation about, you have something to bump into.
Right.
And what gets hard is when we try to make everything fuzzy and work it out for everybody. It's like, oh, for this one, this doesn't count, that one does. A policy gives us something to lean back into that we can apply to everybody.
Right.
We may decide to not charge somebody for a missed session for a variety of reasons, but we have something to bump into. We don't have to figure it out every single time something happens, because life happens, emergency happens, kids are coming home from school because they were getting sick in the nurse's office, or this,
Right.
that, or the car breaks down.
Right.
People are going to miss appointments. How do you handle it?
Right. Because it affects your livelihood, really.
Oh, absolutely.
Right. So, and it's important. It kind of goes back to that whole professionalism, and even when you were talking about your friends, is that, you know, this is still your business. This is still your work. So, like, if one of your friends doesn't show up for work one day, they don't get paid.
Yep.
So, this is the same thing. If a client doesn't show up at your place of business, you don't get paid. So, and then having that cancellation policy when you have those issues, you know, you're right. There's so many different things that happen in life, and especially where we live in the Baltimore, Washington, D.C. corridor. So we're coming from the, you know, Baltimore area. You know, traffic, weather, you know, craziness, the president flying in somewhere, you know, it happens. And, you know, then we also have, you know, illness and all those types of things too, that yes, you can be compassionate, yet still have a policy.
Exactly.
Yeah.
Exactly.
Yeah. Okay. All right. So let's go in a different direction.
Okay.
So let's talk about the individual client in a situation where you're in the treatment room and you have this like chatty client, asks a lot of personal questions both in and out of the treatment room. How do you answer that? You know, what is okay, what's not okay, or, you know, what guidelines can you offer for something like that?
Absolutely. Well, the first thing I want to say is that for different clients are going to talk more or less during session. After all the years I've been in practice, I don't think there's a right or a wrong to that. Some clients are just naturally chattier. Some clients really want to be quiet. So that's not an issue. I follow the rule that says I don't extend a conversation. I'll answer a question, but I don't extend conversation. But then we get to, as you said, the client who all of a sudden really wants to know a lot about me. I've got a decent bio on my website. There's enough there. And there's some things that I don't mind sharing a little more about, things that are essentially kind of public and real. It's like, yes, I've got a 19-year-old daughter in college.
Right.
No problem. But when they're drilling down and wanting a lot more information about her or what I do or where I live or things like that, I feel my kind of shackles go up a little bit, and I get a little uncomfortable.
Spidey senses.
Spidey sense. It's like, this is a little invasive.
Yeah.
And very often it's some nice lady. She probably doesn't mean anything, but I still get uncomfortable.
Sure.
So those are places where I will generally not answer or kind of slow down my responses and chatty, and I will look for ways to turn the conversation back to them and ask them. And one of the best ways to get people back to themselves is, we're doing it, we're in massage, get them back to the felt sensation in their body. So what does that feel like when I'm doing this pin and stretch on your elbow?
Right, there you
Get
go.
them right back into their body.
Right, right.
And sometimes, the classic is, okay, it's time to get face down.
Yeah.
That will quiet a client down. There are a lot of different ways, but I don't feel any responsibility to answer questions. And if somebody is really kind of pushing too hard, it's a perfectly okay time to say, hey, this session is all about you. It's really not about me.
Yeah. Oh, that's a good way of diverting.
Yeah, this session is for you. Tell me about that grandbaby some more, or whatever it is. And turn it back around. And if it went any further than that, and I have talked to people where they really felt that it did go further than that, it is absolutely okay to say, yeah, I really don't talk about my personal life too much.
Right. Or I'm not comfortable.
I'm not comfortable sharing that. That's really not, again, this is really for you. It's not about me. And I've got to add the other side to that, which is, we've all heard stories from clients about their massage therapist who has dumped their entire life in the room.
Oh, yeah. Yeah.
So the other side of that chatty client is, please don't be that chatty therapist.
Yeah.
It's one thing to have a conversation that is dynamic with a client.
Sure.
It's another thing to dump your heartbreak on your client in the treatment room. So that is you having unhealthy boundaries in your professional setting.
Right.
And it is equally as important, and clients have absolutely no idea how to handle it. I've counseled many.
Yeah.
I'm sure you've talked.
Yeah. So I've seen it both ways. The chatty client. So my gauge is always, if they can talk as much as they want in their session, but if they're not relaxing and I can't feel their muscles relaxing, then the conversation just needs to stop. So, but for some, unloading like that, as long as they're not asking you questions, is great. But when the questions get really specific, like you were saying, then, like, I have a few kind of rules with them. I don't talk about religion. I don't talk about politics. I don't talk about personal interactions or relationships with anyone that's a client of mine. I just, just feel like those topics are not suitable for the massage room. But I have had clients over the years that knew when my daughter was going to college and when she graduated, those are like proud mom moments. So, I mean, those are perfectly fine. And like you said, they're searchable, they're public knowledge. But the things that are not public knowledge, you really shouldn't feel obligated to share.
Exactly.
Again, going back to the fact that this is a client-therapist relationship, it's a business relationship, even though it's a caring profession. And we still have to remember that that's what our focus is the client is there to receive a service. We're providing that service, and that's other stuff is sort of ancillary, if you will. So.
Absolutely.
All right. Well, I think we've covered some pretty good typical scenarios. In our next segment, though, we're going to go into some gray areas that maybe might make you feel a little bit uncomfortable, but then again, we've all felt uncomfortable about these sections. So stay tuned for the next segment.